Namaskar, welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 922-6810-630. My dear friend, this is the series going on with the various episodes. Nearly 20 episodes are there in this series, and Dr. Deshpande is discussing the different health problems coming from the patient to the family physician to the general practitioner, and how the general practitioner, family physician think about that particular complaints, how he makes the provisional clinical diagnosis, what type of the examination he performs, what type of the investigation he can do, what type of the management he can do. And these videos are also useful for the common man because they understand these different types of the diseases and their complaints. Okay, so today we have a 7-year-old male child. Now child is there, child. Of course, he has come with the parents, and the parents are complaining about this 7-year-old male child. Doctor, this my child has a fever since last 1 week, and he has also the pain at the knee joint and the ankle joint. His joints are paining. Doctor, I don't understand, because we have heard about different chikungunya, viral diseases, body ache, but typically this my child is having the joint pain, and he has also the fever. Temperature is there. I am feeling that his body is little bit hot. So the doctor immediately, the first thought in the mind of a doctor when 7-year child is there, not a big adult person, not a young person, child is there. So child fever with joint pain is equal to more over 99%. It is a rheumatic fever, especially the child is coming from the slum area. Try to understand. Poor family, the crowded area, infection chances are there. So this is a case. This can be a case of rheumatic fever. I usually tell all the doctors and all the students and all the people, I can have the 3 important types of the arthritis in my general medical practice. 3 types of arthritis. Please note down. Children, rheumatic fever. Middle-aged person, 25 to 55, rheumatoid arthritis. And after 40 plus, osteoarthritis. So what 3 diseases Dr. Deshpande has mentioned? Rheumatic fever, children. Young adult, rheumatoid arthritis. And the old age, osteoarthritis. Don't get confused. Rheumatic fever is typically infectious problem. Infection is there, and it is, if given proper treatment, 100% cure is there. Rheumatoid, middle-aged adult, rheumatoid arthritis, autoimmune disease, no permanent cure, and there is always up and down, up and down, up and down. Pain is more, pain is less, pain is more, pain is no. Continuous. And there is a problem of joint deformity, rheumatoid arthritis. In the osteoarthritis, more over times back, lower back and the knee joint, weight bearing joint, because of the degeneration in the joint space. So one is infection, second autoimmune, and third is degeneration. First 100% cure, second no cure permanently, symptomatic, quality of life can be improved. Osteoarthritis the same, the symptoms can be controlled. Okay, first rheumatic fever, the laboratory blood test is ASO titer, anti-streptolysin O titer for children, rheumatic fever. Rheumatoid arthritis, middle-aged adult, RA factor positive, maybe RA factor negative. Osteoarthritis, especially X-ray test, is very important. I think more ideas are very clear. Now this is the child, and mostly I feel that he is having fever and joint pain. So this is a case of, come on, rheumatic fever. Okay, I will start history taking, interrogation, the doctor should start. Now I can ask his father, which joints are more painful? Actually, you see, doctor, it is very confusing because first his test told me that he has and I saw that he has a problem in the right knee. But now, since in the morning, he is complaining of the left knee and also ankle are paining. So I cannot understand why it is not fixed. It is moving, doctor. Oh, doctor thinks in the mind very interesting and specific symptom of the rheumatic arthritis or rheumatic fever is fleeting joint pain. Fleeting joint pain is very typical of rheumatic fever. What is fleeting? Fleeting means moving. Today elbow, tomorrow shoulder, third day knee joint, then ankle joint, then wrist joint. Moving, fleeting arthritis. The fixed joint is not affected. Fleeting arthritis is a typical feature of, come on, rheumatic fever, rheumatic arthritis. Now, tell me whether you have the child is complaining any chest pain or the difficulty in breathing, breathlessness. No, nothing like that, doctor. He is not complaining about chest pain. No. It's better. Doctor thinking that still there is no complication of rheumatic arthritis, and the complication name is rheumatic carditis. Rheumatic carditis is a complication of rheumatic fever if the patient has not taken a proper antibiotic treatment. Okay. Next question to the parents and also the child. Especially I asked the father whether your child has a throat pain or tonsil problem in these last few days. Yes, doctor, you are right. Yes, you are right. My child had 15 days back throat pain and I have taken some treatment and fever. Few days back he had, I think 3 weeks before. I'm not remembering exactly. Maybe 3 weeks or maybe 1 month before he had that problem of tonsil, doctor. He has always that problem. Again, this is going for more confirmatory diagnosis of rheumatic fever. Okay, because rheumatic fever, this particular problem usually follows a group of streptococcal infection of the throat. Streptococcal infection of the throat, which should be treated by penicillin, but if not treated properly, that infection can give rise to the rheumatic fever. Okay. Then I asked the child to lie down, and with the back of the doctor is examining the temperature. He is keeping the hand on the forehead and on his neck that to check the temperature. Forehead and neck. Doctor is examining. Not necessary to take immediately thermometer. Okay, by back of the fingers you can check like that. You can check temperature. Then doctor will check also again the same conjunctiva pallor. Conjunctiva pallor, because that indicates anemia. And also he can check about the icterus, sclera yellow sclera, icterus, yellow coloration. Then doctor will proceed further with a good torch and a tongue depressor. Doctor will try to inspect throat of the child. Tonsils and throat doctor will examine. Okay. Then further, the doctor will try to check the radial pulse. And he will try to count by counting minimum 1 minute. Try to understand. If now this child has a normal pulse, but if the pulse is more, which is called as a tachycardia. Tachycardia means pulse rate, normal 72 per minute. If it is greater than 30 per minute, doctor can suspect rheumatic carditis. heart problem, rheumatic carditis. Okay, doctor will proceed further by lying down the child on the bed, auscultation by stethoscope. Doctor will check heart sounds, lub, dub, lub, dub, lub, dub, normal. But lub, dub, lub, dub, lub, dub. Can you hear? This is abnormal heart sound, which is called as a murmur. So whenever there is a murmur and tachycardia, both, it is indicating, not in this patient, it is indicating active rheumatic carditis, heart problem. Active rheumatic carditis. Okay. Next, doctor will check the elbow joint, moving the joint, and also he can check the dorsum of the hands and sheen, especially on the sheen of the tibia for rheumatic nodules. Rheumatic nodules. Also, the doctor can check erythema marginatum, a macular eruption with the rounded borders over the chest, abdomen, and back. Please note this point, erythema marginatum in the case of rheumatic fever, macular eruption with rounded border on the chest, abdomen, and back. Now, the doctor will finally go for examining the affected joints for the swelling and also for the tenderness. When doctor touch, patient will scream, he will cry. So that is called as a tenderness. In rheumatic arthritis, joints are always swollen and not just painful. And the affection is of fleeting type. I have already explained you. When one joint is affected, previous one has diminished the swelling and the pain. So that is called as a fleeting arthritis. So my dear friend, we have the case of today, we have the case of rheumatic arthritis or rheumatic fever. What are the important points? Number one, history of tonsillitis or throat infection, because this is post-streptococcal infection, rheumatic fever. Then there will be fleeting joint pains, one after another. Today elbow, tomorrow this shoulder, then again knee, fleeting. Then there will be tachycardia and murmur, heart involvement, rheumatic nodules, and erythema marginatum. These are the different signs. Doctor will ask to check the blood for ASO titer and T streptolysin O titer, and also sometimes throat culture for the group A streptococci if at that time throat infection is present. Okay, then the best treatment for rheumatic fever is antibiotic, that is injection penicillin, and also the control the pain, aspirin can be given, prednisolone, that is steroid, Visolon can be given, and the most important, complete bed rest is advised. Okay. Also, this particular child should be kept under supervision of family physician or pediatrician for continuous next 3-4 years to check there should not be any complication to the heart, because rheumatic fever most of the times affects the heart as a complication, and there is a problem of rheumatic heart disease, that is mitral stenosis. So we want to prevent that, but nowadays big and good antibiotics are there, and this is always controlled, and rheumatic fever nowadays not giving much trouble to the heart. Okay, so my dear friend, this is a short video today regarding the rheumatic fever. So I request all of you to like this video, share this video, and don't forget to subscribe my channel for giving the energy to Dr. Deshpande. Okay, so thank you very much. All the best. Take care and see you in the next video. Thank you.